So I haven't seen you. Welcome. I want to thank everybody for being here tonight. The topic of today's workshop is new baby and how to take care of our baby and how to take care of ourselves. A lot of times we are so worried about making sure that the baby is doing good, that the baby is latching on properly, that we do everything possible for the baby, that we forget about us, and then we begin to have problems. So what I want to talk about tonight is not just how not to subluxate your babies, but also how to not subluxate yourselves. I will talk about things. One second, I lost my mouse. Where is it?
Just keep pulling it to the right. Need help?
One second, I'm pulling it. There it is. To the left. It goes out the left.
Oh yeah, the pull off this way.
Okay, so there are things that we do to ourselves that we can avoid doing. There are things that happen that are unavoidable. There are things that we do to our babies that we can avoid, and there are things that can happen to our babies that we can't help. So what we're going to try to talk about are the things that we have some control of, which is the things that we create for ourselves and the things that we create for our babies. I want to talk very much in detail about how a baby gets subluxated. Things that we have no control of, but that happen every day to babies. And in here I have pictures of forceps delivery and C-section births. Hi.
Hi.
I'm sorry, I didn't know you were here. Right here.
Okay.
I'm sorry, I forgot that you were on the table, but we just started, so I'll begin again. I'm talking about the topic of today, which is how not to subluxate our babies and how not to subluxate ourselves in trying to make sure that our babies get everything that they need. So for babies, one of the major causes of subluxation is the birth process. And whether it happens naturally, even in a vaginal unattended delivery, or even if it happens with forceps, cesarean section, or vacuum extraction, the babies can actually become subluxated from the pressure that is put on their neck during any of these procedures. Think about this, the amount of force that an obstetrician will put on a baby's neck by grabbing their head and pulling on them while the baby is being born can be upwards of 80 pounds of pressure. That is a huge amount. Think about when you're holding a newborn baby, how their head just flops over because they have no real strength in their muscles. So apply 80 to 100 pounds of pressure to this little neck, and you can very easily see how their neck can become subluxated quite rapidly. So a lot of moms, I think that because they had a C-section, their baby shouldn't have any neck problems. There's nothing farther from the truth. In a space that's about this big, they actually have to put their hands in and search for the baby's head and pull the baby by the head. So sometimes they use forceps even in a C-section, but being born by C-section does not exempt a baby from having the possibility of subluxation as well. Even in a vaginal birth, if you look at the bones of the head right here, these bones are not fully calcified. So as the baby is coming through the birth canal, the bones actually overlap on each other to make the head smaller so it can fit easier through the birth canal. That overlapping goes back to its normal, those bones back to their normal position after just a couple of days of the baby crying and breathing and just being alive. Those bones slowly go back to normal. If there is a lot of intervention and there's forceps applied to the baby's head or vacuums or hands putting pressure, what happens is that inflammation sets in the head, and these bones are not so easily going back into their normal position. And as a result of that, the nerves that are coming through these bones actually become entrapped right there. These are some of the most important nerves that are responsible for the baby's ability to breathe, suck, and swallow in a very coordinated manner. Do you know that when your babies are born, they're able to perfectly coordinate breathe, suck, swallow, breathe, suck, swallow, breathe, suck, swallow, about 40 to 50 times a minute, without anybody telling them how. They just know when to breathe, when to swallow, and when to suck. It's just a normal thing. But when these nerves get entrapped, one of these nerves is in charge of the ability of the baby to thrust their tongue forward so that they can nurse properly. Another nerve is responsible for the ability to swallow. Another nerve is responsible for the breathing patterns. So if these nerves are in any way compromised, this baby is going to lose that normal ability to coordinate these movements. So a very common subluxation that happens in the head is usually responsible for babies who are not able to coordinate these three things. And a baby will either gag when you put your nipple in their mouth. They will either not be able to breathe properly, or they won't be able to latch on. They won't have that movement of the tongue the way it's supposed to be for a proper latch. So anytime that a baby is not able to nurse properly, whatever the situation may be, the first thing that we look at is possibly cranial bone subluxations or cervical subluxations in the top here, because that's how the baby gets affected. The other way that a baby gets affected from the birth process is if their neck gets subluxated. It's uncomfortable for them to nurse on one side or sometimes both sides, but more often than not one side. So the mom will say to me, I put my baby on the left and perfectly, but I put him on the right and he just fusses and goes back and arches back. All of that are usually symptoms of subluxations in the neck. They can't tell you their neck hurts, but you can see that on one side they do fine, they can turn their head, on the other side they just can't. Another thing that happens very commonly, a baby that cannot turn their head to both sides equally. You put them down in their crib and they lie just like that. No matter where you are, the baby's always with their head like that, and when you try to bring their head this way, they go right back to that. That's usually also an indication of subluxation in the upper neck. So, see, these babies can't talk, but we can observe them and just draw some conclusions from just their behavior and what happens to them. Why is it so important that babies don't get subluxated? And I think all of you know what a subluxation is, when the bones go out of alignment and put pressure on the nerves. Well, the pressure on the nerves actually begins to cause problems in the baby's health. So whether it's that they can't nurse properly, or that their immune system becomes compromised, their digestive system becomes compromised. A lot of babies that have colic, and that now the new terminology for colic is acid reflux, so that they can actually prescribe Prilosec and Nexium and all these harmful drugs. They're giving them to 3 and 2-month-old babies now, because since they changed the diagnosis from colic to acid reflux, now they can prescribe.
All babies reflux a little bit, you know.
So it's just sad. It's sad to see that babies at early ages like that are being prescribed these heavy medications.
Right.
But a lot of the digestive situations that happen to a baby may also be related to subluxation. And I've had a lot of experience with babies that come to me with what's diagnosed as acid reflux, and really what they had is just a subluxation in the mid-spine, which is the area that feeds information into the gastrointestinal system, and that subluxation causes the baby just to have an abnormal function of the organs. So why is it's so important that we check babies to see if they're subluxated as soon as they're born? Because we want to make sure that their nerves are not compromised, that their nervous system is free from any kind of irritation, so that their bodies can work at the highest possible potential, and that they can express health at the best potential that they can. Let's look at other ways that babies become subluxated, and these are things that we have 100% control of. So I'll go over some of them, and some of them are just going to be, a repeat of the same thing. But this baby, can you see how she's sitting on that Johnny jumper? She's like going forward. Why do you think that is?
Too big for her.
She can't stand up just yet?
She can't stand and she can't sit. Her spine is not developed enough yet to hold the body weight up. If your baby cannot sit on her or his own to hold their body up, you have no business putting them in a sitting position, whether it's a Johnny jumper, a walker, anything. Even a carrier where they actually sit like this and they're in an upright position, they should not be in that position. Until the baby is able to do that on their own, you should not put them in any position, in any contraption that forces them to be like that. So how do we subluxate our babies? We put them in these things before they're ready. Babies that are always on a car seat or a carrier. These are things that really affect a baby. I'm not talking about you go from here to the store and then you take them out. No, but a lot of people actually leave their babies there. Just they're sleeping and they just leave them there and never take them out. Babies need to be able to turn their head from side to side freely. They need to be able to move their body freely and scoot around. If you keep them in those seat belts in one position, you're limiting their ability to move and to turn, which means that you're reducing the ability of the baby to progress with their motor skills and with learning to move in the world. These are not so good either. Even if the baby is able to sit or stand on their own, putting them on here keeps the baby from being able to see their feet. And that doesn't allow them to really understand how their body works and where their feet are and how they need to walk. These things have actually been banned by the AMA. Not for that reason, for another reason, because they cause really bad accidents. There's been a lot of injuries in babies on those. So besides the fact that they're dangerous as far as accidents, this is not a really good thing for the baby. They need to see what's going on, and in order for all of their kinesthetic abilities to improve, they just need to be on their own, able to feel their whole body. These are much better, because with this, the baby's just actually holding on to here and they can see everything that's going on. So I would much rather that you have something like that instead of something like that.
I have a question.
Sure.
How do you define a baby being able to sit up? The fact that they can push up and stay like this?
No, if you sit them
without
on
wobbling?
a bed and they don't fall over.
Okay. So when they fully
Because
do
a
that-
lot of them also will stand up if you're holding them,
Right.
but that doesn't mean they can stand on their own.
Right.
So the fact that your baby
So if
can
they're still
stand,
wobbling over, then they can't sit
they're
up
not
yet.
ready. Yeah.
Okay.
Yeah. As far as diapering routines, make sure that when you're lifting their legs, you're not tilting their pelvis around by having one leg that comes higher than the other. Also, that you don't lift them up too high so that you're actually bending them right here. You need to lift them up only enough so that you can slide the diaper under and nothing else. If you lift them up too much, you're actually bending their spine in the wrong way, and that's not beneficial for them. If you're using those disposable diapers that have the sticky labels, what are they called? Pads? No, the tapes. The tapes. Make sure that you don't press the tape onto the pelvic bone. Put your hand inside of the diaper and then press the tape against your fingers rather than pressing the tape into them like that. Because I don't know how many of you have seen me adjust a baby. How much pressure does it take to adjust them? Hardly any. You're actually putting a lot more pressure by doing that on their hip than I put by doing an adjustment. So you can actually subluxate them by putting pressure on their hip like that. Tummy time. This is one of the reasons why you don't want babies to be in car seats a lot also, is because you're preventing them from being on their tummy. You should never have your baby sleep on their tummy. That's not so good because it keeps their head turned and it really just twists their neck around. But when they're awake, putting them on their tummy is really good because it helps to strengthen all these muscles of the neck and upper back, and it helps them to begin to create that cervical curve. Remember when we showed you your x-rays some of you don't have the normal curve here. We're not born with those curves. The curvature in our neck and the curvature in our lower back are not present at birth. We are born with what's called a C curve. So the baby's spine actually looks like that because they've been, like this in the uterus. When you give them tummy time and they begin to do that, guess what they're doing? They're creating their cervical curve. As soon as they start getting on their hands and knees and they learn to crawl, they're actually creating their lumbar curve. So by keeping them in a car seat, for example, or in a carrier constantly attached, you're keeping them from being able to create these curves that are so vitally important. Now we're going to talk about you and how you can not subluxate yourself. This lady is carrying a car seat. Can you see how different that is than if she was carrying it right here? What do you think is easier for the spine, for our spine?
How she's doing it.
Yeah, because remember when I've talked to you before about never lifting something this far away, but always trying to be as close to your center of gravity as possible? That's one of the best ways to carry one of those carriers, is whether you have a strap or actually just with your arms, on either side of the carrier, but as close to your center of gravity as possible so that you're not having to strain your back. If you have a baby in the car seat and you carry the baby like this, the amount of effort that your spine is making is tremendous, and you can actually really hurt yourself and create subluxations by doing that. So some of the options that you have to that are to carry the seat empty in one hand and carry the baby on your other hand. That's actually a really good option. You can carry them, next to your body like that. You should avoid carrying them right here with the arm extended. Definitely avoid carrying the baby for long distances, even if it is like that. It's not good for your back. And avoid carrying your baby if there's any other way that you can carry them. So we'll talk a little bit about slings, but that's what I'm talking about here. If you have a backpack or a sling, it's better to do that than to carry them in the carrier. And as far as suggestions for carrying your baby, the golden rule is that your sling should approximate the way that you would carry your baby with your arms. So depending on what age your baby is at, different slings are going to apply. A little baby will do much better with a sling like that. Because if you were carrying your baby, you would be carrying him or her like this. So that's exactly how this sling is going to put the baby in that same position. Or you're going to carry the baby like you are, just like a little frog right here. And those slings actually allow you to do the same thing. You put your baby like a frog here, and then you strap the sling around you. As the baby begins to get a little bit bigger, then different slings are going to apply. As soon as your baby is able to sit on their own, you can actually put them in one of these that sits them up. The one that I don't recommend at all at any point is the one where they're actually hanging by their crotch. See the difference here? These babies are actually sitting. They're sitting on their buttocks. There's some that you actually slide the baby in and their legs just go straight down and they're literally just hanging by their crotch. That is terrible because any malposition of the baby is causing tremendous subluxations in their pelvis. So really, if you just want to know which sling to use, think about how would you carry your baby at this age in your arms, and get a sling or get a backpack that will pretty much mimic that exact same thing. Something that we call new mom's neck, that is very common, and it means that your neck and your upper back begins to hurt you tremendously, and you're wondering why. But if you start thinking about the activities that you do day in and day out with your baby, you'll begin to see why. How about getting your baby finally to latch on, but you have tried so hard that by the time they actually latch on, you're like this. Then you're afraid to move because then maybe they unlatch. So that's one thing. You're in a really weird position nursing. Even if they're in a good position and you're in a good position, you are so in love with your baby that you just can't help but look at them like that. So your neck is in this bad position or that bad position for 30 or 40 minutes every couple of hours. So thinking about how to prevent this new mom's neck, just start thinking about options. Like Rachel, you were telling me how you nurse on your lying down a lot. That's a really great option, lying down, because you can be totally relaxed and you don't have to be in awkward positions with your neck or with your shoulders. So thinking about other things that you do that might cause you to have problems. One of them is changing their diaper in the wrong position. So instead of bending your body over like this to change the diaper with all the bending coming from your waist, instead of that, bend your knees and keep your back straight and do the same thing. That way you protect your back. And here I showed picking up the baby from the floor, the crib, or the bed. Same thing applies. Don't ever bend over to pick up your baby like this, because what you're doing is all the effort is coming from your lower back. Instead of that, always keep your back straight and strong and bend your knees, and then bring your baby as close to you and then lift them up with your leg muscles, which are actually the strongest muscles that we have in our body. Another common thing that happens to new moms is pain in the wrists, tingling or numbness in the hands or in the fingers. And again, if you watch what you do, you will figure it out probably what's going on. During pregnancy, some of this is normal just because of swelling, and there's things that you can do for that. But after the baby's born, check the following things. Are you holding the baby with your arm, with your wrist in a bent position while you're nursing or in any other time? Are you sleeping with your hand like that? Are you holding the car seat with the handle hanging from your forearm and your wrist like that? So just paying a little bit of attention to the things that you're doing on a daily basis probably will help you discover what it is that you're doing. But if you are having some of that carpal tunnel syndrome symptoms, icing is something really, really good, because the reason why you're hurting is because there's inflammation in the wrist area. And you can stop all the activities, but you also need to lower the amount of inflammation, and ice is the best way to do that. I have put on here some of the common stretches that will really help you to deal with a lot of the problems that we're talking about. And I have a handout right here that I'm going to give you. So all of those stretches are right here, and they involve things for the neck, things for the upper back, the lower back, for your wrists, for your legs, so that you can stay in shape even while doing everything you need to do with your baby. Other things that I'd like to talk about are how to take care of some of the most common things that may happen when you have a new baby. The most common thing that happens to new moms is to get mastitis, which is an inflammation which can then become an infection of your breast. And it usually happens because milk ducts get clogged up, and the milk starts to back up in there, and then it just becomes red and swollen and hot and very painful. If you catch it soon enough and you allow the baby just to nurse a lot on that side, you can probably take care of it. If it becomes more of a problem and by having the baby nurse it doesn't clear, one of the easiest things to do is to get into a hot tub on your hands and knees so that you have gravity helping, and to massage your breast very, very lightly, because it is very painful. So just barely, just put a little bit of pressure, and you will see how little by little the plug will start to release, and then you can have the baby nurse and it will just take the rest of the way. If still that will not help, Applying grated potato to your breast is a great way to reduce the heat and the inflammation of mastitis. You literally just grate the potato, put it on your on the tissue or on your breast, and then just put a little cloth on it, and when it dries you take that off and you put a new potato, and it'll draw all of the heat of the inflammation out of your body.
That's what I did after for hemorrhoids.
Did you?
Potato, put it on the napkin, and that's what the midwife said, and it worked amazing.
It's an unbelievable thing. An unbelievable thing. Fevers. This, I'm talking about your baby having fevers. The fever is the natural mechanism of defense in our bodies. Whenever a bacteria or a virus is invading us, the body will immediately raise the temperature because it knows that viruses and bacteria cannot survive in high temperatures, right? We know that too. What do we do when we want to sterilize a pacifier? We boil it. It's the same thing. So the body will raise the temperature in order to kill an invading bacteria or virus. So in all of our wisdom, what do we try to do? We try to lower the fever. What is that doing? It's actually going against what the body knows it needs to do. So if your baby has a fever, you can monitor the fever and make sure that it doesn't get out of hand and that the baby is not going to suffer for it. But this is what normally happens with fevers. They're worse at night. So after 9 o'clock or 10 o'clock at night, they get a lot worse. That's because the body knows that that's resting time. That's when it can do its better job of killing the virus. So when the fever gets worse at night than during the day, don't panic. That is normal. The fever will peak, but it will not stay at a high temperature for long. The body will immediately drop it because it knows that it needs to protect some of the really sensitive membranes in the eyes, in the brain, in the spinal cord. So it'll peak the temperature, but it'll drop it immediately, and then it'll peak it again. So if you were able to just track the temperature, you will see that that's how it happens. And that's not dangerous. Dangerous is when it stays here for a long time. But in a normal person, that's not going to happen. The fever is going to go up and down. If your baby is really, really uncomfortable, lowering the fever is not going to make them any more comfortable, but figuring out what's wrong, like if they're having any kind of pain in their ear, for example, you can put a wet cloth near their ear, a warm cloth. You can put some drops of warm oil, lavender oil, even olive oil, warm. You can put it in. So find out where the fever is coming from and try to give the baby something that will calm them down from that aspect rather than trying to lower their fever. Because if you do lower the fever, you're killing all the effort that the body is doing to protect itself. Just make sure that they don't get dehydrated. That is the only thing that you have to worry about when there's a fever. You need to constantly be giving them something to drink. If they won't drink, take a face cloth and just squeeze water into their mouth. For coughs and colds, if you're still nursing, if the baby is getting really congested in their sinuses and in their nose and in their chest, a really good thing to do is to go into a bathroom, turn the shower on as hot as you can, and just sit in the toilet with your baby and let the baby nurse. That forces them to breathe through their nose. They will breathe all that steam, and it really clears them out completely. You can also put inside of the bathroom, while you're in there with all the steam, a little facial steamer with 3 drops of these 3 different essential oils: thyme, cinnamon, and clove. And then that will just permeate through all of the steam, and then your baby will breathe that in as they're breathing through their nose while you're nursing. So these 3 oils have antibacterial, antiseptic, antimicrobial properties. They are almost like taking antibiotics. That's how good they are. So if you're able to have your baby just breathe that, if it happens to you, you can actually just put it on the stove in a pot and just make it boil the water and take a towel and put it over your head and just breathe that. It's a great way to get relief from sinus infections without having to take antibiotics.
Do you think that they're better than eucalyptus oil?
No, actually, that's also a really good oil. But somehow the combination of those three just makes a really good synergy for that. But eucalyptus is also really good. Okay, so that really goes along with that as well, respiratory infections. And then I just added this because a patient told me the other day, and I loved it. Instead of putting the solution that comes in the store purchase wipes, you can actually make your own baby wipe solution. 3/4 cup of distilled water, 1/2 cup of aloe vera juice, 5 drops of grapefruit seed extract, and 1 drop of lavender. And you can actually keep it in spray bottles and use it for everything, to wash their hands, to wipe them, keep them in the car for spills, and it's totally non-toxic and natural.
Can we write that down? Is it written down somewhere?
I wonder if I wrote it down here for you. No, I didn't, but I'll pass this around and then you can use the back of it to write if you want to. So I'm going to pass out 2 handouts. One is the stretches that will be very helpful to you, and the other one is a list of how we cause subluxations in our babies and how to avoid them. So take one of these each and just pass the rest. Clove, cinnamon, and thyme. Okay, at the bottom of the stretching handout is a list of our resources. And these are websites that have really, really great information about children and how to deal with common things that may happen to children in natural ways. So the ICPA is the International Chiropractic Pediatric Association. Our website is AJ Chiropractors, and then holisticmoms.org. By the way, Dr. Johnson started this, or helped to start this Holistic Moms organization. They meet the 3rd Wednesday of every month at the Neptune Beach Library at 6:30 p.m. And then the Leche League, experts in breastfeeding, they meet the 1st Wednesday of every month at 10:30 a.m. at Palms Presbyterian Church. And these are really great resources where you're going to find other moms who are also looking to do things naturally. Any questions? Okay, well, we started on time, we ended on time. Thank you very much for being here.
Can you flip back to the slide that has the diaper short, please?
Let me see if there's a better way to do this. There it is.
Oh, I'm sorry, the solution for the...
Oh, the baby wipe?
Yes.
There it is. Thank you.
It doesn't have to be refrigerated, this
No.
baby wipe solution.
It doesn't.
That's the solution, and then you can buy some nice cloth or something.
Yeah. Yeah.
That's great. The grapefruit seed is also what they use to wash. That's the ingredient in the fruit wash. When you get the fruit spray, wash your
Oh,
fruits and vegetables.
is it?
It's grapefruit.
Yeah, it's probably a very good antimicrobial.
It's an antifungal.
Mm-hmm.
That's neat.
All right.
Okay.
Thank you very much. Which one?
I'm sorry, I'm keyboarding them down here.
Thank you.
Yeah.
Yes.
This one.
Oh, is the other one?
The other one.
The causes of subluxation. Did you get this one?
Yes. Thank you.
It's here.
Oh, thank you. She's been out and about all day, so she's been here.
Oh, wow.
Yeah.
So these are the stretches that we are to do?
Yes, and they're explained right here.
Oh, have fun.
They're good like that too? With one leg
One
up,
or the other.
one or the other.
Thank you very much.
You're welcome.
I have a question, Dr. Altman.
Yes.
But if a child developed a supplication in birth, so how many years after can you still work on them?
Well, I work on people that are 40 years old that have had subluxations since they were born. So the thing about it is that the longer the subluxation is in the body, the more chance it has to create havoc in the spine. So it would be much better to get a child right away and adjust them right away.
Yeah.
But there's always something that can be done.
Okay. And you work on, little toddlers, 2 and 1. They're not still for very long. You work on them as well. Yes. Okay.
Yes, we do. We have our ways.
Okay. Thank you.
You're very welcome. I'm glad you were able to make it.
Me too. Thank you.